Hi, this is Dr. Adam Stewart, and I'm back with another video to help show some of the invisible work that family doctors are doing behind the scenes that goes unnoticed. And this video is going to be about the chain of reactions that follows incidental findings, so findings on usually imaging tests and all of the work that family doctors have to do to order tests and follow-up tests and track results. Kind of related, on my website I have the blog section. And if you go to the blog section and you look down, and I've already got two articles on the relevant articles on this, or videos, the cost of even a simple FYI interruption and the invisible work regarding paperwork after a visit. So those two videos relate. The cost of a simple, even just the simplest check-off reaction shows that there's at least $6 of cost and interruption. But more to this point is the invisible work, the paperwork that doctors have to do, usually after visits regarding ordering tests or referrals. And this video shows how it really adds up. We're talking 6 to 10 or even 15 minutes of extra paperwork. So when a family doctor has to order a CT scan, for example, this video kind of shows all the time and steps that are required for that. And you have to do that multiple times a day. Those tasks really add up. So when we start looking at incidental findings, so I'm going to show you some examples. And we get countless examples of these throughout our week, but every family doctor can relate. But here's a few examples that I'm going to show you. Here's a CT scan, and it was ordered on a patient for left lower belly pain and wanted to rule out diverticulitis. So we get the result, and by the way, this is a report that this is an example report the doctors have to scan through, line by line, making sure we don't miss anything. And then we get down to the conclusion section. And this CT did show some diverticulitis, but the point of this video is to show you the things that aren't even related to that. So when you're looking at doing a CT scan of the belly to rule out diverticulitis, you might see some other things that you weren't even looking for that are really even, usually they're not even clinically significant. They don't harm the patient. They're just benign findings that you wouldn't have seen had you not done the imaging test. So in this example, it's saying, oh, by the way, there's also some a spot in the liver that could be that they're suggesting doing a belly MRI. And also there's some scarred spots on the right pelvis area that you should do a bone scan on. So family doctors then, you would think that this would be automatic, right? But it's not. Family doctors then have to go not only contact the patient and tell them we're ordering these tests for these incidental findings, but then actually do all the paperwork to do it. So we have to go in and order an MRI, which takes actually a good 5 to 10 minutes to order an MRI, and we have to order the bone scan in this case. And then our staff have to do the tracking and all of that too for these tests. Now, I want to contrast that with the local breast screening program at Belleville Hospital. It's fantastic. If a woman has a mammogram that shows any kind of spots, not necessarily worrisome, but anything at all that's kind of not perfect, and they need follow-up imaging, the radiologist and the staff at the hospital come out, tell the patient right there on the spot, and then, here's the key thing. The follow-up imaging, like let's say the woman needs a follow-up ultrasound, or a follow-up mammogram or a repeat type of view on the mammogram in a few weeks or months. It's the breast screening program. It's the hospital that automatically orders these follow-up tests. The family doctor does not have to do all the paperwork. It's fantastic. Yet here we are with every other test that we get. It's the family doctor that has to do all the paperwork. And I understand that there's reasons why you wouldn't want to have order automatically follow-up tests on everyone, but the default should be to automatically order the tests, and then the family doctor could then cancel if they didn't see it relevant. My point is, but the mammogram example, it shows that it is possible to do this. Why no one's doing it, I don't know, especially when family medicine is in crisis like this. So then the patient goes on. This patient goes on to get the bone scan, and from that CT I just mentioned, order the bone scan. So I order the bone scan, and so it's okay, but you should also order another one in 6 to 12 months. Again, this should be automatic. Family instead, I have to go do 5, 10, or 15 minutes of paperwork to order this test. Another example: person who had a chest X-ray, and they say continue a short follow-up, which usually means like 4 to 6 weeks. So again, instead of that being automatically booked with the patient directly, nope, the family doctor is the one who has to go order this follow-up chest X-ray in a few weeks and track it and all the stuff. So then this same patient, we do the chest X-ray like they suggest in a few weeks, and nothing acute, no pneumonia. Oh, but there's a 2 centimeter density that needs a CT scan. So again, you think that would be automatic? Nope. Family doctor has to go do all that paperwork to order the CT scan. We get the CT scan on the patient, and it was fine. Here's an example of a patient who had a bone scan for rib pain. And, nothing, no abnormalities seen, but, while we're looking at this, we saw something down in the hips that, it's probably nothing, but do a bone scan in a few months to follow up. Again, should be automatically done? Nope. I, the family doctor, and my staff have to go take the time to order this test and do all the paperwork for it. Here's a CT scan of it. Was done for refractory cough, a persisting cough. Again, got to sort through all these words and notes. Oh, we get to it. Nothing's wrong. No acute abnormality. But by the way, while we're looking in there, there are some tiny nodules, which are not scary words, by the way, but they need follow-up in about 12 months. And also, when we also see a thyroid nodule. Again, it has nothing to do with why we ordered the test, but because we see it, we have to report on it. And they recommend a thyroid ultrasound. You'd think those tests would be ordered automatically, and wouldn't it be a great help to the family doctors who are in crisis and overworked and overburdened to have these follow-up tests automatically scheduled and done directly? Nope. The family doctor and our office has to order all these follow-up tests. Finally, and again, I have countless more examples, but I'll end it here with this one. This was a CT scan of the neck that was ordered because of an incidental. So this is in the middle of the chain reaction of a CT a few months prior. So this is a follow-up that, again, I had to order by myself because it wasn't done automatically. And then, so similar and stable appearance, yeah. But they say an additional, get another CT in 12 months. Oh, also, there's something going on with maybe the hyoid bone, or a thyroid cyst. So order an ultrasound on that. Oh, and also there's you should order a CT of the thyroid directly. So again, all these tests, you'd think that these would just be all automatic from this thing, and I could just get the report in a few months when they're all done. Nope, I have to go do all the paperwork to order all these tests. So this is a very big burden and drain overall on family doctors, family medicine, and our staff and our clinics. And I just point out that the answer is possible. We've seen that if the mammogram program, for example, the tests can be ordered automatically. We just need to start doing this automatically by default for every other test.